Hello friends, welcome back to our channel Longani Clinics. Today we are going to discuss one of the most modern, comprehensive and practitioner friendly repertory in homeopathy, that is Murphy's Homeopathic Medical Repertory. This repertory has become extremely popular among the students as well as practitioners because it successfully combines classical homeopathic philosophy with modern clinical requirements. It bridges the gap between traditional repertorization and contemporary clinical practice, making it useful in almost every type of case. Dr. Robin Murphy developed this repertory with a clear objective to create a modern, practical, and easy to use reference book. He believed that homeopathy should not be divided into rigid school of thoughts. According to Murphy, the physician should prescribe according to the need of the case rather than blindly following any single method or theory. He emphasized that the right way to prescribe is revealed by the case itself and by the results obtained in the practice. One of the most remarkable features of Murphy's repertory is its philosophical foundation. Unlike many repertories that strongly favor the method of prescribing, Murphy attempted to integrate the best ideas from various masters of homeopathy. His concept of totality includes Kent journals, Bonninghausen's complete symptoms, Bogar's pathological journals, and important clinical principles developed by other homeopathic stalwarts. This broad approach allows the repertory to adapt to different kind of cases. Murphy believed that the construction of totality should depend upon the information available in the case. If a case presents strongly mental and physical generals, the physician may follow Kent's method. If complete symptoms with rich concomitants are available, Bonninghausen's approach may be more useful. If pathological generals dominate the case, Bogar's principles can guide the prescription. This flexibility is one of the greatest strengths of Murphy's repertory. When you look at the structure of the repertory, we find a very simple and logical arrangement. The chapters are organized alphabetically according to anatomy, physiology, or clinical topics. Even the rubrics and sub-rubrics within the chapter are arranged alphabetically. This greatly simplifies the search process and remove much of the complexity found in the older repertories. The repertory contains 74 chapters arranged alphabetically, beginning with abdomen and ending with wrist. Each chapter starts with a general rubric and then proceed in alphabetical order. Rubrics are printed in bold capital letters, sub-rubrics in bold Roman letters, and further subdivisions are arranged systematically beneath them. Cross-references and synonyms are provided whenever necessary, helping the practitioner quickly locate it or quickly locate the desired rubric. Murphy's repertory is exceptionally adaptable. It can be used in cases where mental symptoms and generals are prominent, in cases dominated by pathology, in cases presenting complete symptoms, in clinical conditions where diagnosis is important, and even in cases where only a few symptoms are available. Few repertories offer such versatility. Similarly, Murphy allows different methods of repertorization depending upon the nature of the case. One may work from generals to particulars, use complete symptoms consisting of location, sensation, modality, and concomitants, prescribed through pathological journals and causation, or even utilize clinical rubrics combined with modalities. This makes the repertory suitable for both classical and clinical practitioners. One of the reasons for the popularity of Murphy's repertory is the enormous number of additions and new rubrics it contains. Special chapters such as cancer, clinical, vaccination provides valuable information rarely found in older repertories. The repertory also includes a large number of diagnostic rubrics and modern clinical conditions, making it highly relevant for present day practice. Another strength is rich remedy representation. More than 1600 remedies are included, along with an additional grade of remedy evaluation. Nosodes are particularly well represented. Many modern remedies have been incorporated from standard homeopathic literature. The repertory also contains many fascinating and clinically useful rubrics. For example, under the clinical chapter, we find rubrics for jet lag, elements from injections, weakness after influenza, AIDS, Meniere's disease. Under mind, there are rubrics for attention deficit disorder, ritualistic behavior, romantic feeling, anticipatory anxiety. Such additions demonstrate Murphy's effort to keep homeopathy aligned with modern clinical realities. There are also numerous constitutional rubrics such as alcoholic constitution, cancerous constitution, lymphatic constitution, melancholic temperament, phlegmatic constitution, hydrogenide constitution. These rubrics help the physician understand the patient as a whole rather than merely treating a disease. The repertory includes many pathological conditions as well. We find rubrics for cirrhosis of liver, cancer of liver, gallstones, cataract, retinal detachment, ankylosing spondylitis, hydrocele, phimosis, vitiligo, keloid, Bell's palsy, and many other conditions encountered in daily practice. This extensive clinical coverage makes Murphy's repertory especially attractive to the practicing physicians. However, like every repertory, Murphy's repertory has also got some limitations. Although it claims a complete alphabetical arrangement, chapter still begins with general rubrics. The repertory contains a large number of diagnostic rubrics, which may sometimes encourage disease-based prescribing rather than individualization. Certain rubrics from Kent have been combined, occasionally altering their original meaning. Some critics also feel that greater emphasis is placed on particulars and diagnostic conditions than on general symptoms. Despite this criticism, Murphy's repertory remains one of the most practical repertories available today. It combines classical philosophy with clinical utility, incorporates modern medical terminology, and offers solution for wide variety of cases. Whether you are a student learning repertorization or an experienced practitioner managing complex clinical cases, Murphy's repertory can become an invaluable companion. In conclusion, Murphy's homeopathic medical repertory represents a successful synthesis of the teachings of Kane, Bonigason, Bogar, and modern clinical homeopathy. Its simplicity, flexibility, extensive clinical content, and user-friendly alphabetical arrangement have made it one of the most widely used repertories of the modern era. Thank you for watching. If you found this video helpful, please like, share and subscribe for more videos on Homeopathic Repertories, Materia Medica, and Homeopathic Philosophy. Thank you.